Hi, everyone, and welcome. Today kicks off our first session of the ID Solutions and Ignis Health webinar series. We're so happy you took the time to join us. Thank you. A few housekeeping items before we get started. This session is being recorded, of course, so if you can't stay the entire time, not to worry. We'll send you a recording when we're done. For the sake of time, all questions will be addressed towards the end, but if anything does come up, feel free to chat or submit a question in the Q&A section, which is located in the center of your toolbar. Today, we're ultimately here to discuss how you can leverage grant funding to expand your telehealth services in 2021. But more specifically, we're going to review those grants, criteria, and how to apply, the benefits of leveraging Ignis's Health ROI and analytics tool, and share some success stories based around key case study examples. For today's speakers, we have Rob Solomon and Philip Wolford of ID Solutions, and Ajib Ben Brahim from Ignis Health. So without further ado, Rob, if you could get us started by sharing a bit about IDS, our end-to-end telehealth solution capabilities, and just a quick background of our partnership with Ignis, that'd be great.
Sure, thank you. And thank everyone for joining today. Hopefully you all are staying safe and staying healthy. ID Solutions was founded in 2000, so we've been around for 20 years. And our founders started as a video communications company. That's where we wanted to be. That's where we wanted to go. And our main headquarters is in Indianapolis, Indiana. That's where our founders were from in that time. They started at AT&T. AT&T decided that they didn't want to do the video side of things anymore as a direct part. So our group got together and said, hey, let's do this. Let's have this need. There's a need out there for video. So around 2000, 2008, or 2008, 2009, we decided that healthcare was a need. There's technology starting to come together. People are getting used to being on video calls, and we said that we wanted to put a focus on healthcare and telehealth in general. And when we did that, we started to come together and go, well, we don't want to just show in Indiana. We want to be nationwide. So we have a nationwide sales coverage for the things that we do. And we had different applications, different things that people wanted, so different turnkey type solutions that they were wanting to do. We had things like people wanting carts with medical grade devices connected to them, so like hardware, etc. And they wanted those things managed appropriately, so we can do the management piece with that. We have software that can go on top of it, just like what we're using today, what we're using with video via DYO. And we can do everything with like implementation, installation, etc. And we know that security is very important to our partners, our customers, etc. So we make sure that all of our users, all of our support desk is HIPAA trained, so that you know that you're getting the best support available. Now, as all these things happen, I mentioned 2008, 2009, we started with healthcare, and a lot of the people who did telehealth initially were just trying to do it because it was something that was starting to become more user-friendly. And as the different technologies came about, like the Zooms, like the videos, it became even more user-friendly. And people got used to actually seeing their provider on their phone or through their computer, etc. And people were enjoying what they were doing. I mean, telehealth managers at different hospital systems were going, yes, we understand our system, we understand how things were going, we understand the health of our system. So we were doing well, and then COVID hit. And once COVID hit, the ideas, the thoughts around telehealth changed. It went from a nice to have to a need to have, and it grew exponentially. We have one of our customers who was doing roughly 300 encounters between patients and providers per week prior to COVID. And once all the growth happened, March, April, May, once that growth happened, they were seeing 1,200 patients a day. So that was a big change in the overall look and feel of telehealth. And once that happened, everybody grew, and we were helping. We're trying to be very helpful to the people that we worked with. We were helping, and they're going, we don't understand where we are. We don't understand our usage. We don't understand how successful, unsuccessful that we have been. And we're like, yeah, we understand, and that you're having troubles. We're having troubles too, trying to help. Then one of our partners, Video, introduced us to Ignis Health. And then Ignis Health talked about the analytics that they could do. And once those conversations with analytics started happening, light bulbs started going off left and right and over, and the conversations we had is like, this fits a need. This fits a big part of what we're trying to do. And as we saw the different things coming together, we have these telehealth solutions, and now we have analytics, and they're coming together to start telling a larger story. And then we're like, well, how else can we tell this story? What other things can we do to enrich the story? And right around March, like actually right before the first wave hit, we hired Philip Wolford. That's going to be talking next. We hired him, and he started talking to us about grants, and that's part of the reason why we brought him on board. And his knowledge with grants, etc., started putting a larger picture, a bigger story in place. So with that being said, I'm going to turn over to Philip to dive deeper into the grants.
Thanks, Rob. Thank you, everyone, for attending. My name is Philip Wolford. I used to be a telemedicine director for some hospitals. And that's where I learned the strategy and the use of federal funding to help me expand my programs and to help my communities and help my other partner hospitals. So I was fortunate enough to write and win an FCC grant, which allowed us to expand our technology of communication. And then I was fortunate enough to also write and win 2 USDAs and a HRSA grant. That allowed me to partner even stronger with my other hospital systems and organizations to help deliver telestroke services, psychiatry services, cardiology services, and things of that nature. So grant strategy is a little difficult because it takes time to understand and study what grant is applicable for your organization. So I'm going to go over just a couple things about why choosing the right grant. And then I'm going to discuss a little bit about how to apply. And one of the things that we do offer here at ID Solutions is we have professional grant writing partners, and those partners can help you. They can do a full provided service for you, or they can just do a reviewing service for you if you need it. Then I'll try to go over very quickly just some of the criteria. Who's eligible? Why are you eligible? That type of stuff. So for example, one of the big ones that happens every year, it's an annual grant. It's called the USDA Distance Learning Telemedicine Grant. So now last year, the USDA upped the amount to $1 million per applicant from 500,000. And they also reduced some of the restrictions for rurality. So it made it more eligible for people to go after. So it's great for technology. They love to fund carts. They love to fund the hardware side of it. So we're just showing you this is a distance learning. This one will be up in April. But there are also grants out there right now. Now, this is an example of Health and Human Services. And this one is very unique to our product line because it goes after evidence-based falls. So we have an application, a SaaS application that's designed to help reduce evidence-based falls. So what can this help you with? This can help you buy the hardware and the SaaS program that you need to reduce those falls and reduce those liabilities. And you can also now bill for those services. And I'll touch on that at the very end. There's also a very large grant. One of the reasons we came here today was to, can you go to the next slide for me? One of the, this really struck me as being a viable solution that we could all use. So this one's coming out in January. This really struck me because it's $150 million. It's going out to 75 award winners, and it'll allow you to optimize your virtual care program. And that could be just about anything. Can I improve my licensing? Can I buy more equipment? Can I buy more managed services? Can I buy more answers? Can I get more help? So it has a lot. Now, there are restrictions on these things because, as you can see, this one says you have to be an H80 award recipient. And my point on all this is that we can help you understand if you need help. What can I get? How can I get it? Where do I get it from? Can you help me expand so that I can deliver more services to my community, right? So that's, this part of the presentation. So when you're doing a grant application, they'll ask you very specifically, what do you want the money for? And how are you going to use the money? So I can put in a variety of things. So I could say, I need help with 24/7 help desk. I need help with monitoring my network because I don't have the staff to keep my equipment monitored all the time. I need hardware, telemedicine, mobile carts, like you see behind me. Maybe I need to outfit some rooms on my university so that I can teach my nursing students or my future doctors. I need USB scopes and peripherals so I can do examinations more effectively. So it's how do you dissect the budget is basically what I'm getting at, is understanding a good narrative, because what you're trying to do is tell a story. You're telling a story to the federal government, the guy that's going to review it, and he's going to say, what are you going to do with funds if I give it to you? So you come up with a good story, and then you come up with a great managed scope, so they understand what you're doing with the money, and you can put different percentages of how you're going to use the funds, and that explains to them that you get what the grant's about. Okay, and then on the other side you'll see software. So you can, and the reason, and I'm going to hand this off to Najib pretty soon, is that when you write a grant, you're going to get audited if you win the grant. It's not a question. It's going to happen. They're going to come back and they're going to say, okay, we gave you $1 million. What'd you do with it? Now, you can either have a bunch of analysts or you can have products ingrained and put with your solution, like Ignis Health. And why is that important? Because it tells you how effectively you're using the money, where you're using the money, where you're not using the money, and also it can track billing. So let's say that you use some of the new codes like the 99223 for patient observation in COVID and non-COVID cases. I need to know who's using it, where are they using it, why are they using it, is it effective, is it making my system more effective and better? Okay, so that's the data analytics piece that is very critical, and it helps you build your services out even better. So with that, I'm going to turn it over to Najib.
Thank you, Philip, and thank you, Rob. It's a pleasure to be here, and thank you also to you and the ID Solutions team to have us on this webinar. In the context of what Philip was presenting, you're obviously, hopefully you're going to be applying to many grants and winning many grants. And with that, it comes what I call the burden of reporting back to the grant officers. And these reports might not be fully sort of operational. It might be specific to the grants. And so you might end up doing one-off reports on specific metrics to different groups. And so, unfortunately, the way the system is set up right now, at least in most health systems that we work with and in contact with, the system is not set up so it's the reporting and analytics is agile. So in the grander scheme of things, I would like to sort of present this as being more strategic, and it's not necessarily just linked to the grants. And part of the challenges that we've seen is that telehealth is facing sort of new challenges, but not entirely new. So prior to COVID, we were working with a lot of organizations to understand the ROI, the financial sustainability, and it was basically vital for the survival of their program and their growth. Now the challenges are a little bit different in terms of everyone is seeing a spike in demand for new services, expanding existing services. And with that, the challenge is, how do you optimize? How do you really utilize your resources the best way? And your resources are complex and very diverse, as you all know, when setting up telehealth, because you need your clinical team, you need your IT team, and you need your legal team and credentialing. And so, but those challenges are not entirely new, because even prior to COVID, a lot of telehealth, at least the infrastructure, was set up based on grants. And unfortunately, very few people were strategic with those grants. So they didn't really think about how do we make this or these programs that are initially funded with grants to become more sustainable. And that's where we think we bring a lot of value on the table, because we can help you really fully automate those reports, talk to the different data that are typically in silos. We all know that you use so many different systems or vendors for video capabilities and sort of, in a broader term, digital health capabilities. And so that's what we wanted to talk to you about today, in terms of how we can help you really understand what happened during COVID and how you can sustain that, and within the context of these grants, how can we really help you save time and focus your resources more on developing and sustaining these different service lines, telehealth service lines, rather than building reports and getting bogged down in Excel spreadsheets. So with that, we wanted to present to you a couple of use cases. I always think it's important to sort of share with everyone we talk to, whether it's a customer, sort of benchmark the knowledge that we acquire from one telehealth group to the other. And just to caution you, there is no sort of magic pill that I'm going to prescribe today to say, these are the list of metrics that you need to track, or this is how you make sure your programs are going to succeed and are going to be sustainable in the future. However, we saw a couple of processes and a couple of sort of system changes that we played a part in establishing with our current health system partners, where we basically, for example, helped with auditing and compliance. That's important in terms of, if you have many carts and hundreds of sites where you have these carts, it's important to know if you have a cart that's sitting and collecting dust versus you have a cart where you have an increased demand on and people are not able to schedule time on it. So that the asset management, the asset monitoring aspect of it is something that we can help automate. The second aspect of this is really the traceability. And in a lot of cases, we find multiple telehealth vendors, sometimes even multiple video technologies, multiple EMRs. Sometimes there are multiple billing systems. And if you really are trying to optimize and understand your program, you want to have the full picture so you can paint the story to the different stakeholders you're talking to. And in a lot of instances, we were very successful at linking the clinical call logs or call details to the actual clinical documentation from the electronic medical records to the billing records. So you can have the full picture of, the calls that are happening. You can trace them to the actual documentation, and you trace them to the actual dollars that you're charging and hopefully getting paid on. The third aspect that I wanted to cover is how expandable this is. In a lot of the health systems we work with, they typically do have an analytics team, and they work with a visualization tool, and they think they have everything. The problem with that is the process is very clunky. So if you have different service lines, different sites that you work with, these are different requests that you're putting to the data analytics team. And so you put in the requests, you wait for the data to come in, you validate that data, then it goes to the Tableau team, for example, and then so it's a never-ending story, because the nature of analytics, you see a metric, you start asking about new metrics. And so having the ability to have a platform and a process that you establish so it's expandable and you can apply it across the different departments that you have, across the different service lines, is very important. Now, the second use case that I thought was really important is basically the objective from this one. It's around reimbursement, which is sort of a hot topic in telehealth. It's been, that's what's been on everybody's mind forever. But it's really about the sustainability of the program, because if it's a cost center, if it's not revenue generating, or if it's not introducing some cost saving measures, then it's not going to be sustained over time. And if we're talking about the context of grants, you need to think about that, because if the grant runs out, or if it doesn't get renewed, then you're going to have to figure something out, or just shut down the program. And we've seen that in a couple of places, unfortunately. With reimbursements, we basically do have a platform so you can ask questions around what's your payer mix, who's paying these charges, what are the processing times, what kind of bottlenecks do you have in your billing process, and sometimes you can compare the billing across different departments, or even sometimes the performance between billing person A versus billing person B. And then the last one is really to analyze different scenarios of what kind of revenue you're leaving on the table in terms of reimbursements. So with that, I would like to pass it to Kayla to have a Q&A, and we're happy to answer your questions.
Thank you, Najib, Rob, and Philip. Great job, guys. Let's see. I'm actually going to turn it over to Monique, who's been tracking our questions today and who will address those and field them appropriately. Monique?
Perfect. Thank you. So a question that came in is, are you able to report on decreases in hospital admissions and readmissions?
Absolutely. Okay, so with the use of the carts and the system, we can analyze admission records, and we can see if, for example, let's say somebody got discharged from the hospital who's diabetic, and we are able to then educate them using systems like this, and they do not reappear in the hospital in under 30 days. That is reducing my readmission loss ratio. So yes, we have the ability to go back and peel back the onion or reverse analytics on this and determine, did we reduce our readmission loss rate? Because that's where the hospitals usually take the hit. The average readmission loss in this country is $15,000 per incident. So you can imagine on a weekend how a hospital might lose $100,000 because their people are being readmitted in under 30 days. So yes, there are ways of going back and determining how to analyze data. Am I reducing readmission issues?
Yeah, and Philip, thank you for that. The only thing I would add is it's also important to understand that the notion of readmission, maybe in the context of the penalty, is well defined, but sometimes the office of the CFO wants to look at it differently in terms of what's the readmission window, what kind of patient population you want to target. And so all those types of analysis we can help you with as long as we do have access to that data.
Okay, next question. Someone had heard that the USDA may not take new applications this year, that they are going to use the applications from the second round last time. Have you guys heard that?
I have not, but I'm going to reach out to the USDA after this call and I'm going to ask them.
Okay,
I have friends there and I'll get you an answer.
perfect. And then what agency is funding I think you put a link in there, Philip, to someone, and she was wondering if who's funding it. Is it USDA or HRSA?
Okay, so, and I was answering this, I guess I'll just do this for the group. What I do is I'll go to grants.gov. I will go to the tab that says search grants. I will then go to the left-hand side under the word agency, and I will check mark healthcare. It will remove, or I'm sorry, categories. On the right, on the left-hand side, you'll have a check mark box for categories. You go down to the word healthcare, and you'll see there's 1,398 open grants. So what it does is it's filtering or querying out grants that don't make any sense to you, to your organization, right? So now you're targeting on grants that are specific for the healthcare industry, and that's where you can start determining, is this a good fit for me?
Someone said, does it matter what video platform or telehealth platform they are working with?
From an analytics perspective, not really, because we're vendor agnostic and we understand that you might be using different technologies. So from our perspective, it doesn't. We do have some great existing relationships with ID Solutions and video and other partners as well. So from our, for analytics, it doesn't really matter.
They were never eligible for grants in the past, and how do they know if they're eligible for grants now?
Okay, great question. So what I would do with the hospital is I would ask them, first question, do you have a grant writing team? Right? And I would be able to determine whether or not they've ever submitted a grant and have ever won one. If they do not understand that and they need a professional firm to help them, we would work with them and the firm to determine whether or not you're eligible and whether or not you meet those criteria. For example, the USDA, you can do what's called a hub and spoke model, where you can have a metropolitan hospital that also has partnerships or letters of agreement with rural hospitals, and therefore you make it eligible because you have increased your rurality score. I did this in Northwest Pennsylvania. I was able to do letters of agreement with Titusville Hospital, Corey Hospital, and also the Westfield Hospital. And because I brought them in from a mothership or hub and spoke model, I was now eligible to be funded. So there's ways, there's logic, there's strategy around it. And I would love to help you if I can.
Perfect. A really great question is, are we able to analyze the number of patients treated using program funding?
Ooh.
I think that might be for Minty.
Sorry, can you say that again, Monique?
Are we able to analyze the number of patients treated using program funding?
Yeah, in some instances, we can actually track them. Sometimes it's using smart phrases with the EMRs. Sometimes they're actually tagged. Or we can help you come up with a way to filter specific patients or specific encounters that are part of the grants. Prior to this, we actually worked with some HRSA funded grants where we actually kept track of the encounters and patients that were treated as part of the grants because they were using it as sort of reimbursement. And so it is entirely possible, but I want to caution you, it really depends on how you set it up, and we can help with that aspect as well.
Perfect. And then there's two other questions, but we can answer them directly because I know Kayla needs to kind of round this out. So back to you, Kayla.
Perfect. Thank you. Again, thank you all for joining. And Rob, Philip, and Najib, thank you for your time and speaking with everybody today. Just so everybody knows, we will be following up again with the recording, a copy of the slide deck. And as Monique mentioned, if you did have a question that was not answered live, we will take care of that via email. Keep an eye out for a message from Kyle Sanborn, who'll be working with you guys to schedule follow-up calls. But if you do have any questions, you can reach out to Kyle or Monique, who can get you in touch with the appropriate representative at IDS or Ignis. And last but not least, this is the first session of our series. So next time we will include our partners at Video, give an update on the grants that will be available in January, go over a solution that includes IDS hardware and services along with video and analytics from Ignis. And we will be hosting a joint customer of the three of us and discussing their success story in more detail. So again, everyone, thank you very much. We'll be in touch, and of course, feel free to reach out if you have any questions.